Hello doctor, hope you are doing well and thanks a lot for supporting my channel. However, I noticed that a few doctors and healthcare professionals are watching my content but they are not sharing or subscribing. So please subscribe my channel to receive very valuable hospital growth strategies and ideas. Today, I would like to talk, or you can say discuss, a very interesting and one thing, extremely hectic and dangerous issues for doctors and hospitals. What is that? Medical negligence. Yes, this problem has caused frustrations and traps for many doctors and hospitals across India. You know one thing? Recently, the number of cases has drastically increased, reaching approximately 5.2 million annually. As the CEO of 50-bedded multi-specialty hospitals and a healthcare business consultant, I understand the importance of this issue and how you can prevent it. So this video is purely for educational purpose. As a doctor and healthcare entrepreneurs and healthcare professionals, you might be aware of this seriousness of medical negligence. Also, it is your responsibility to educate your staff and your team and your colleague and everybody. They may not fully understand the potential of consequences. For that, in this video, I will discuss the 8 major types of medical negligence that occur in your hospitals. Keep watching till the end as I provide valuable information and some examples which happened recently some other hospitals, so it will help you to enhance your quality and giving the best results for your patients. So let's get started. Number 1, incorrect diagnosis. One of the major and familiar issues is incorrect diagnosis. See, misdiagnosis can lead to wrong treatment plans, causing significant problems and potentially worsening patient's condition. For instance, in Delhi, a case highlighted this issue when a patient received the wrong treatment due to misdiagnosis, resulting in severe consequences, including patient's death. So you can check it the news on New Indian Express. So my advice is always double check your diagnosis process. Utilize multiple diagnostical tool and consult with your colleagues if you think something is uncertain, and also implement a protocol for second opinions on critical diagnosis to help prevent these problems. Number 2, prescribing errors. Prescriptions error are another major contributor to medical negligence. A significant case involved recently in Tamil Nadu hospitals where a woman was prescribed incorrect medication. It has been leading to severe adverse effects. You know one thing, the court mandated compensation to the patient, underscoring the severity of such errors. So many hospitals do not properly manage prescriptions, I know very well, so especially the smaller ones. When I visit as a consultant to many hospitals, I often notice that staff do not care or follow the doctor advice properly on their prescriptions. So my advice is, please ensure that not only you but also your staff are very and fully aware of the prescriptions and the importance. Recently, courts have ordered that prescription should be very clear and preferably in capital letters. So my humble recommendation, you can take that, utilizing electronic health record, the EHR or EMR systems, to minimize these errors, and proper training and coordination on how you can use this system effectively, and also how you can bring the significant results and reduce the prescription related issues. And number 3, dose miscalculation. See, dose miscalculations can have dire consequences. I know very well. Personally, I had this experience, including severe adverse effects or even fatalities. These errors often stem from manual mistakes or outdated patient's information. For example, I would like to share with you a recent incident in Mumbai involved a patient who received an incorrect dosage for medication. This incident leads to highlighting the need for accurate dosage calculations. So what should you do that? Number one, utilize digital tools will help you a lot. So implement automated system and digital tools that accurately calculate dosage based on patient's data. So many tools are available, many softwares available, you can utilize that. And number two, continuous training. So regularly train healthcare providers on dosage calculations to ensure they stay updated on best practice. And number three is very important, that regular audits. So I know very well as an NABH coordinator, so many people do not know this kind of idea. So please conduct regular audits of prescriptions practices to identify and rectify potential error. And my fourth tip is standardized protocols. See, develop a follow standardized protocols for calculating and administrating dosages. And number five, and again I'm telling you very consistently, that double check. See, encourage a culture in your hospital where the double checking dosage is a routine practices, especially for high risk medications. I had very bad experience in many hospitals when I visited. They don't know this kind of information. The fourth, poor drug distribution practices. See, improper drug distributions can lead to patients receiving the wrong medication or dosages, often due to administrative errors or miscommunications within the healthcare team. I know very well that many hospitals have the team politics. For example, a hospital in Chennai faced legal action when a patient was given the wrong medication due to labeling error, resulting what happened? She had a severe health complications. So my advice is, you can take tip number one, stringent protocols. Implement very strict and stringent protocols for drug distribution to ensure accuracy. Advice number two is staff training. Regularly train staff on proper drug handling and distribution practices. I know very well many malpractice, this kind of issues happen by your staff. Advice number three, barcoding system. Use barcoding system to track medications accurately and reduce your errors and your manual work burden. By following these practices, hospital can minimize drug distribution error and enhance patients' safety. So in this video, I have discussed, or you can say I have revealed only the 4 types of medical negligence. So remaining the 4 medical negligence, I'm going to share with you in my next video. So keep updated. Until then, the Latif signing off.